We're here today with Michael Cover, GRC Program Manager at Blue Cross Blue Shields, Michigan. He's going to share with us some of the successes that he's had at his very extensive GRC program. Michael, could you set some context and tell us a little bit about Blue Cross Blue Shield, the industry, and some of the risks and challenges that are facing the industry as a whole?
Thank you, Yo. Blue Cross Blue Shield of Michigan, we are an independent licensee of the Blue Cross Blue Shield Association. We are 78 years young. We are responsible for 6.1 million lives. We design, build, and support health plans for individuals, companies. We have traditional PPOs, HMOs, dental, vision, Medicare, Medicaid. So we are the largest health payer in the state of Michigan, and we're one of the largest in the country. So in terms of kind of where we're at and what we see from an industry standpoint, our landscape is constantly changing. Regulations, there's always changes to regulation. We never know what's going to happen tomorrow, and we have to be mindful of those risks that could pop up. And honestly, Yo, the risks that we see today aren't the same risks that we were seeing 15 years ago. So there's always something new, and these are things that we got to be able to track and monitor and manage to.
The regulatory landscape must be moving quite quickly in this industry. Mm-hmm. How do you really anticipate regulatory change, and how do you build an organization that is agile and can adapt to these kinds of changes?
Well, we've built a great program, and honestly from a compliance side, we're really only responsible for a small piece of it. We've got other departments that are from legal to federal public policy, state public policy, that are really responsible for managing the regulation and the change as it comes in and the interpretation and making sure we're aligned across the business areas that are impacted. But added to that, we've got an area in the business that's responsible for implementing that regulatory change as it comes in, an Office of National Health Reform. And we've got a lot of great leaders and a lot of great team members and staff that are responsible for those implementations. So in terms of any kind of significant regulatory landscape change, you know, we got a lot of great people in the right places of the business to be able to manage that change as it comes in. And you know, I'm confident and we're confident that whatever that change is, we'll be able to meet it head on.
Excellent, excellent. Can you describe your GRC program as it is right now, its scope, but also its goals, and what are your priorities over the coming years?
So when I came into Blue Cross, we had one simple goal, and for us it was truly an enterprise vision. I was challenged by my senior leaders, Michelle Samuels and Kelly Lang, early on at arriving at Blue Cross to say, hey, our vision, our goal is to take the program enterprise-wide, get us there. And so when we started, I walked into a situation where we already had a vendor, we already had a system purchased. We knew at a high level what areas were interested in implementing GRC in some form or capacity, from things such as policy management, issue management, metrics, monitoring within their business, those self-assessments, tracking work papers for internal, external audits, compliance projects, things of that nature. And we knew who those areas were, and we had gone through a process of prioritizing based upon kind of mini business cases, if you will. So what's the value you're going to get? What are you going to try to do? And it was important to be able to align on those common processes. Mm-hmm. And we prioritized each one of those areas. And around the time when we actually started to automate and implement systems and solutions, that was really around the time of the Patient Protection Affordable Care Act coming out in 2012. Right. So for us, that was our pilot. We started small. We started with that focus because we had an idea on what the government oversight was going to look like for that, because it was being governed by the Center of Medicare and Medicaid Services. So for us, it was really a process of, we got an idea from a Medicare Advantage business. We've got this new thing that's coming into play, new huge piece of legislation, and we want to manage it. We want to make sure that we're maintaining compliance. So we said that's going to be our pilot, and we implemented, the first two modules that we implemented were compliance management and issue management to support our processes. And we had roughly around 60 to 70 end users in that, and those were really like our first line of defense. They were our compliance liaisons. They were the people that were in the trenches that were reporting their monitoring, their metrics, their self-assessments. If they had an issue, they were reporting that too, and their associated actions. And we rolled it out to the business. And what we found pretty quickly about a year later, as we were kind of moving along with our program, even with just that small core user group, was that they were grasping at things. They were grasping at the reporting. They were grasping at the workflow. and they were holding on to it, and they were running with that in their areas. So they began to just report not only what we were asking them to from a compliance perspective, but more. They were putting in their weekly, their monthly, their quarterly controls, and they were utilizing the system and the solution. And all while that was going on, we were moving on in our prioritized space. So we began a pilot with model audit rule, and we partnered with the business. And that's the big thing, is partnering with the business in everything that you do. You can't go at it alone. They've got to be there with you. And if you just go and implement a tool or a process and they aren't with you as you're doing that, you're not going to have any traction. They're not going to use it because it's not theirs. So we took that listing that we did back in 2011, 2012 of each one of those business areas, and we're plugging away, all while this initial user group's starting to use the tool more and more and more. And so we're implementing model audit rule, we're implementing at the time in 2015, and we're implementing with other areas, enterprise-wide attestations with that group I was mentioning earlier with Office of National Health Reform for the Affordable Care Act piece. And what we found was that more people were using the tool. We were really starting to climb the ladder as it related. It was. And people were using it. They were really grasping to that reporting above all else. They were really grasping on that reporting, and it was allowing us to manage things more clearly, concisely, with greater transparency. And then we kind of moved forward, and 2016 for us was really more about more module implementations, more processes, and we rolled out additional modules, additional functionality. We did a platform upgrade. All of 2017, very challenging for us as not only a program, but as a business as we were implementing this additional functionality, because we had a lot more people involved. We had our initial user base, we had their leaders, we had their executives, utilizing and relying on the tool for some of those things that they've been doing in managed silos applications. So they had a lot of siloed applications that they were using. Everybody has their own Excel spreadsheets. Everybody's got their own SharePoint site. And the big piece was we were able to retire that functionality, get them to use the tool, and begin to roll out that functionality in those new applications to those areas. So then we fast forward to 2017 and we have more pilots. So we keep checking down that listing of prioritized areas, and we're constantly updating that list. And every time we update it or every time we shift things around, we're working with them to define what's your mini business case, if you will. And we're holding each other accountable throughout the process. We're really trying to do something with our program, and it's a mantra that we're living by throughout the entire enterprise right now, and it's really do different, do better. And this is something that we're really living from a program perspective, and we're going from process enablement and area enablement and pilots, biting off small things to get them into the tool.
Failing early.
Exactly, bringing them in, and then we're implementing new modules, and then we're rolling out to additional business areas, and we're implementing more modules.
So you're using an agile process on the entire readiness rollout.
We have to.
Equation.
And we have to, and we really have to focus on that readiness and that process maturity. And what happens, and we found this several times actually, every year or so, we wind up shifting that priority, and it really gets back to the need and that maturity of that process. So if we have to have that nimbleness in everything that we do to be able to shift things around, and we've been doing that now for a few years, and we've had a lot of success with it. Not to say that everything's always sunshine and rainbows and everything goes well. We have our hiccups along the way. Maybe we roll out a process a little bit early, or there's some functionality that we have either within our process or within the application that maybe we either overestimated a little bit, or we have to tweak or change or configure additionally. But in the end of the day, it's all about, from a program perspective, not only trying to challenge ourselves, challenge the areas to get them into the tool, but enabling them, and partnering with them.
And so when you're doing these mini business cases, are you looking at cycle time reduction and process streamlining, those kinds of things?
We're really looking at the strategic aspect of the application, because what we found from a GRC perspective, it truly is a strategic implementation. There's really not, overall from a program perspective, you're not going to see hard cost savings in a lot of these systems and processes. You're saving a lot of time, you're streamlining your processes, you're getting people to use the same tools, so you're getting that transparency, you're able to hold those business areas accountable. And what we try to do is we quantify that if it's cost avoidance, if it's how much time is it going to save us from a reporting perspective. We really quantify all that detail, and we hold the business areas accountable as we're going through this. And we work with, we've got like continuous improvement areas within the organization. We work with them. We work with a lot of enterprise initiatives and programs as well, because we want to make sure that we're partnering with these groups and that they know what we're doing from a system and program and process perspective, and we're bringing in those new areas because they're a feeder for us.
Right, and they are really on the same page with you on how these successes are occurring and
Correct.
what kind of benefits you're really achieving.
Yeah.
So I want to shift gears a minute and talk a little bit about the MetricStream community and the special interest groups, our MSIGs, and the GRC Journey Guidebook for Champions, which has so many artifacts in it that help people roll out their programs. I know that you've used this, and I wanted to get your views on how did that help Blue Cross Blue Shield in building and rolling out your program? How do you use those artifacts?
So the MSIGs are great for us because it allows us to connect with other healthcare companies that are kind of trying to do the same things we are, allows us to connect with other industries that are doing the same things we are. Because it's GRC's really, it's industry agnostic, it's tool agnostic really, but you're going through those processes and you're saying, how are you guys able to implement A, B, and C? And even things like the GRC Summit and the conference and being able to meet with leaders and the other program managers and have those conversations, it's been great. But I'll tell you, like the Journey Guidebook has been since it's come out, it's been great for us because it's really put us in a situation where as we're refreshing some of our tools and our enablers, we go there first to see, hey, what's already out there? Because I don't want my team recreating the wheel, and I want us to see what other companies are doing. And then we use the Jive site and be able to query what those other companies are doing and be able to bounce it off of them. It's really helping us to gain synergies across all the healthcare companies. And even, like I said, I can't say enough about events like the Summit and the ability to bring those leaders together to be able to get real-time updates. And we've made a lot of contacts through that, and it really carries forward throughout the community, throughout the MSIGs. And we share those tools and those enablers amongst ourselves. So it's been a real benefit to us.
It's excellent having you so engaged as well these last few years on our special interest groups. And I know that every time I go to a healthcare company, they said, yeah, we've talked to Mike Gover. Yeah, we're on the community. We reached out to him and we've had conversations. So there's a lot going on. And that's the way it should be, crowdsourcing and us not getting in the way. It's wonderful. So let me ask you again about benefits that you anticipate and where you see it going in the next few years. How is this program going to grow, and what kinds of really transformative benefits do you expect to see?
Right now we're in the process of really changing the culture of compliance as it relates back to automation and transparency. The tools and the modules that we're implementing right now make it so that everybody in the company is going to have access to our solution. They're going to have access to MetricStream in some
going to be
form or
pervasive.
capacity.
Yeah.
Exactly. They're not even going to realize it. So in the implementation we're doing right now, it's everybody's going to have all employees are going to have access.
And what app is
it's-
that you're implementing right now?
We're implementing the case management solution right now. So it is everybody in the company is going to have access, all 8,100 employees roughly. And it's going to impact and change the way that we do things. And while we're doing that, it's allowing us to automate solutions across areas that handle and touch the same types of functions. So we're bringing these areas and these business areas, and we're leveraging their shared controls and beyond that, their shared processes and their reports, and they're going to be leveraging the same module, and that's a significant win for us. And so for us, it's really, this year's about getting that module in play with those business areas and being able to drive that synergy across the board with each one of their leaders, the teams, the analysts, and even the end users that are going to be actually entering information in the system. And it makes it a lot easier for us as new areas come in and say, hey, I want to try to do policy management. I want to try to do issue management or monitor my self-assessments and metrics. It's easier for us to be able to go in and say, oh, you've already been using the tool, you just don't realize it yet. And it's going to be, from a standpoint of where I see that's going for us, it's just going to be at the end of the day, delivering on the vision that we were challenged with on day one,
5 years
which
ago.
was Mike, I want everybody in the tool. I want us using the application. I want to start to drive to more enterprise-wide reporting. And I want us to start leveraging common processes wherever we can. And that's what we were challenged with on day one, and that's what we're driving to right now.
Right. And I know you've come quite a ways on your journey. You've probably, a third of the way there from your perspective?
I think it's somewhere a little bit, maybe a little bit more than a third. I think it's, for us, it's going to be, we'll be at a point from a module perspective and a functionality. We're in a really good place right now. In the next year or two, I think we'll be in a really great place. And it really just becomes tailoring the application, the applications to meet the business needs, and doing enhancements to make sure that things are clear and simple for the end user.
I remember a couple of years ago we had a conversation and we talked about these phases, these maturity phases of risk identification, risk analysis, and risk intelligence. And it sounds to me that you've moved well beyond risk identification. You're right in the middle of analysis, and then there's some things that are happening that are going to allow you to reach into risk intelligence.
And that's really the next big thing, is we're really trying to drive overall enterprise intelligence. It's not even just about risk itself,
it's about
or issue.
Performance.
It's just it's just straight intelligence for us. We want to be able to make smart decisions based upon the and have the information, the detail right at our fingertips as it relates back to it.
Right, making it simple, better performance.
Clear and simple to the end users, because if you think about it, if you're rolling it out to the entire enterprise, that's every level of the organization. So senior executives need to be able to log in, see their reports immediately,
and see it on their mobile,
and see exactly their iPad, their phone. They know exactly where they're at, or if they're in a meeting, they know exactly how to log into the tool, get into the application, 1 or 2 clicks, and they're at the answer that they're looking for. And that's significant. That's really where we're trying to take our program, our tools to the next level.
Excellent, excellent. So, Mike, what kind of advice would you give to peers in your industry who are just embarking on such a journey?
So anytime I'm on the phone or we're talking to those new companies and they're saying, hey, what would you do? What have you done? What would you recommend? What would you do differently? I always go back to a few things. And the first one's always readiness. Readiness above all. You want to make sure that you know the processes that you're going to start with. You're starting with something small, nice pilot area, something that's probably more mature than other areas. And by doing that and focusing on that pilot in a mature space, and you've got all the readiness documentation, process documentation, policies, procedures, they know their requirements, you can start to drive that initial step into an automated solution. And if you're driving that initial step to that automated solution, and you're partnering with them.
Partnering is key.
And you have them at your side when you're doing business case presentations, and they are just as hyped up about the tool and the solution as you are, things go really well. If you're going into a process where, hey, I bought a tool, I haven't really talked to the business about it yet, I'm implementing it, and then I'm going to bring it to them later, you're never going to get traction. There's always going to be a pushback from the business because they weren't there with you. They weren't your partner throughout the entire process. So identifying those common processes within the business, identifying those leaders, partnering with those leaders, partnering with the analysts, partnering with the managers, the directors, the VPs, and up. Because it's not just about working within your own level from a GRC perspective, especially at the program level, but it's working up and it's working down. And you really want to make sure that you have partners at each one of those levels. And then beyond that, once you've gotten to that point and you're saying, look, I've got some program objectives, I've got my initial pilot, I know who I'm working with, my partner is helping me define those objectives, you can begin to get into those common elements and start to really drive from a foundational element perspective a common taxonomy for issues and risks.
Right. So I'd like to actually ask this question about how the awareness of GRC has grown in the company over the last few years. I know they're using things and they don't really realize they're doing GRC. It's sort of that's the nirvana.
Of course.
But how much of this foundational library structure has really been a success factor for you in this?
Significant. So from us, it makes bringing up areas easier. because we all across the company are governed by that same risk structure.
Yeah.
And it's really driven from our enterprise risk management department, and they're great partners of ours. But even that structure itself, we've got a committee and it's overarching across the
You've got the
enterprise.
working group that gets a common language.
That work group gets together at least annually. We try to get together, at least, if we can get together quarterly, we do. And we take feedback throughout. And we try to make sure our definitions are clear and simple and that everybody in the enterprise can understand them so that
What it is.
a critical issue it makes sense, a high issue makes sense, medium, low, insignificant, and the same thing from a risk standpoint. You know, it's well above and beyond impact times likelihood, right? So we're starting
Absolutely.
to coordinate in other things like speed of onset.
Exactly. And it's really required in order to have an analytics framework. If you don't have that simple definition and agreement in common language, you can't hang the arithmetic on top of it.
Of course.
Yeah, so that's great. That's wonderful. So, Mike, it's been a pleasure speaking with you, and it's been a delight working with you the last few years, and I wish you the best in these new priorities and look forward to working with you some more.
Oh, thank you very much, Yo.
Thank
Absolute
you.
pleasure. Thank you.
Bye-bye.